To better understand what diabetes is, let's learn about the function of glucose and insulin in our bodies. Glucose is a simple carbohydrate found in many types of food. Its main function is to supply the body with energy in order to meet its needs. Insulin is a hormone produced in the pancreas, and its main function is to facilitate the absorption of glucose by our cells, consequently decreasing the concentration of glucose in the blood. Thus, we can conclude that if there is no this hormone, there will also be no absorption of glucose by our cells, thus raising the concentration of glucose in our blood, which characterizes diabetes. Now that you know what glucose and insulin are, let's understand diabetes. There are three types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. In type 1 diabetes, the pancreas, which is responsible for producing insulin, does not produce the hormone or produces it in insufficient amounts due to the destruction of the cells responsible for its production. Thus, the concentration of glucose in the blood increases significantly, and the person has to apply insulin daily through injections. The cause of type 1 diabetes is still unknown, but many doctors believe that it may have a genetic or autoimmune origin. This type of diabetes can occur at any age, but is more common in children, adolescents, and young adults. Its symptoms are thirst, hunger, excessive urination, etc. Type 2 diabetes is very common in adults over 40 years old, overweight, sedentary, and smokers, but in recent years, it has been diagnosed in younger people due to poor eating habits, sedentary lifestyle, and stressful life. In type 2 diabetes, either the pancreas produces insufficient insulin, or it produces insulin normally, but the body cannot utilize it in the correct way. Unlike type 1 diabetes, type 2 diabetes is most often asymptomatic. Gestational diabetes manifests itself during pregnancy, and in most cases disappears soon after delivery. Some women may develop type 2 diabetes after pregnancy. Women who have this type of diabetes have a specific follow-up with their physician during prenatal care to monitor the risks for both mother and baby. Women who are overweight, who have had pregnancies where the baby was born weighing more than 10 pounds, or who have already had gestational diabetes are more likely to develop this type of diabetes. People with a family history of diabetes, obese people, sedentary people, smokers, and people with high cholesterol, among other factors, can also develop diabetes. The treatment of this disease will depend on the type of diabetes that the person has developed. In type 1 diabetes, the person will need to take insulin injections for the rest of their life. With type 2 diabetes, the patient will need to follow a diet, exercise, and take the correct medications prescribed by the doctor, among other things. In gestational diabetes, the mother-to-be must follow the doctor's recommendations to the letter, because there is a risk that the baby will have problems at birth. These are the three most common types of diabetes. If you like it, leave your like and share it.